My name is Sarah Hotchkiss. I own Catalyst Wellness Coaching downtown. I also work at the doctor's office on the south side. Um, I'm a licensed mental health therapist and functional nutritionist. So I tend to see people with a lot of autoimmune stuff, a lot of GI and gut things, which we're going to talk a little bit more about today. Um, a lot of menopause and perimenopause things, and then anything metabolic, kind of weight loss related. Those are kind of the four kind of probably the biggest areas that I spend most of my time with. I'm right downtown across from what will be the Children's Museum this fall. So that's where my office is located. So I get to see the construction every day. So it's kind of cool. That's okay.
Yeah.
Is there a specific reason that any of you guys came today or like questions you have almost just like high level before I start? Because then I can make sure to hit those as I go. Did you come for the topic specifically or yeah, okay. Okay. Yeah. And
I do.
Candida and yeast is like it's a difficult thing to treat. Bacterial overgrowth in general, like we're talking about yeast and fungus today. I was just mentioning to Amber, I struggle with a bacterial infection condition that tends to come up every 1 to 3 years probably for me, and it's just such an overhaul to like treat it. And as much as I do, and as much as I know, I don't know how everyone else kind of deals with it. But I see a lot of people with like bacterial infections, and so um, I know how to treat mine, which is good, but takes a bit to get meds on board and I do a specific diet and until then you just feel like you're run over by a tractor. So we'll talk through that a little bit about today. So Candida is basically yeast in your gut. And so when I do stool testing with people, that's usually how I pick it up. Um, we can go through and kind of talk through symptoms and stuff too. And I'll do that a little bit today. The thing that's hard is that you might be having gut symptoms, and it could be candida or yeast. It could be methane or hydrogen sulfide bacterial overgrowth. It could be Helicobacter pylori overgrowth. It could be Klebsiella. It could be these all these millions of different bacteria and other things. So it's like hard to know. Regardless, the symptoms kind of feel the same. Um, Root causes are generally the same, although it varies. Some of mine is anatomical actually. Um, but it stinks to have. Like it's hard. And you could jump on the internet for hours and like get lost in all the everything you're supposed to do about it. And so it's a mess. Um, and the symptoms a lot of times.
Is what you believe.
No, sure, right. And so the symptoms a lot. That's perfect. Um, the symptoms too are just like widespread, like across your whole body. Or some people like yeast overgrowth and they don't know because they're just assume they're supposed to feel like that, or it's something else. We've attributed it to something else. Or I hear people say, "Well, I've always had that, so it's not a big deal." I'm like, "Well, you've always had that, so it is a big deal." Like you shouldn't have that. Um, and so usually, if you have an overgrowth in yeast, digestive issues, gas, bloating, constipation, diarrhea, significant brain fog, I can speak to that specifically. Sometimes oral thrush, your tongue. So one of the things that people look at in the morning when they wake up is what their tongue looks like. And so look and see if you have like a white overcast on your tongue or, yeast. A lot of times dentists will pick up on that too. Uh, if you're getting, and we'll talk about oral hygiene a little bit today specifically. Skin and nail issues sometimes. Scalp or just in general, like patches. You could have like rashes even. Um, and then again, this could be other things, but because it could be high cortisol, it could be, but sugar and carb cravings. That's like everybody you talk to, but that can control other things. But like yeast can be a reason too. Um, and so what I'll talk through today a little bit is sort of like lifestyle and ways that you can treat it. I'm going to talk about going to the doctor and getting like a diagnosis and some of the stuff that they do there. Although usually it's just an antifungal and sometimes it works, sometimes it doesn't. But I want to give you all the food things and all the other things to do to make it more effective and to make it last longer. Because if you keep getting the infection, that means you're not sort of getting at the root of why you keep getting it and you can continue to treat it. And after a while, if you continue to treat it with like, let's say diflucline or something like that, after a while, sometimes that stops working too. And so then you're like really up a creek and you don't know, it's hard to know kind of what to do. So top big things to avoid, and I'm going to give you this list. You're going to be like, there's no food left, but there is. It doesn't have to be forever, but like for a few months, a great thing, great things to avoid if you are trying to knock yeast out of your body. Number one, sugar. Probably knew I was going to say that. This also includes artificial sweeteners. So a lot of people go to like sugar-free stuff, but that messes up your gut microbiome too, especially sort of in excess. Yeah. So stevia is kind of like that one. Stevia and monk fruit are the two like sort of safer ones from a candida perspective, I would say, because they're not sugar alcohols. Um, I have not personally noticed in practice that there's a lot of people that are still having issues with stevia around candida. But I think with anything, I think it's like the amount too. Like you putting it in everything all day, or is it just sort of like here and there? Monk fruit, not erythritol, but like monk fruit, I don't have any issues with, and I would say stevia, um, next to none that I have noticed. So yeah, but a lot of the artificial sugars, like sugar alcohols, so anything ending in an OL, those are the no-goes. In fact, that's probably one of the biggest things that if I were to turn over a granola bar or something that looked really yummy to me, even if there's only a few ingredients, there's a puppy. I see. Let's edit that out. I'm like puppy squirrel. If I see a sugar alcohol, I like immediately put it down because I know for me in particular, some people it's fine. For me in particular, that'll put me out for days probably.
Like the syrups.
All the yeah, the coffee syrups. Yes, I know. They have, a lot of them have that. And so, and in fact, um, geez, I'd probably rather do a little bit of sugar, than some of the sugar alcohols for sometimes. But again, everybody's gut's different. So, okay, so number one, sugar and artificial sweeteners. Um, Number two, alcohol,
Mhm.
beer and wine in particular. Wine is fermented, so yeast, beer, fermented, yeast, means of course depending on kind of what you get, like if you were to get like a dry red or cabernet, probably not as much, but still they're both fermented, um and contribute to candida except the yeast. Yeah,
Like kimchi and sauerkraut.
I'm gonna get to that.
Oh,
I'm gonna get to that because I have mixed feelings on it, but I'm gonna get to that. Yeah,
apples.
I'll get to that too. If you have active candida symptoms, this list is what I'm suggesting you cut out completely. After you've treated and let's say it's negative and you feel okay, then you might relax on some of this stuff, including the fermented foods. I usually actually, so a candida diet a lot of times has some fermented foods in it. If you have active candida, I would say no fermented anything, which is the way I am when I have my gut, when my bacterial overgrowth, I can literally cannot touch anything fermented, not a pickle, not a sauerkraut, not nothing, because think about it, it's just fermenting. You already have all these fermentable gases, and then you're just like adding to it. We tout that those are healthy, and they are in balance. But if you are currently dealing with bacterial, yeast, fungal overgrowth, they're probably going to set you like over the edge. Yeah. And so so I notice, just because I've had this for 30 years, um, I notice when I feel fine, or mine's most recently treated, I can have some of that stuff and I feel fine. Not in excess for me. I probably wouldn't do the kombucha or like something like that. But here and there, a little bit of sauerkraut. I'm not going to eat like 2 cups of it, but I feel okay. However, when I'm currently battling the infection, there's no, even an apple. Like I just won't. I mean, I feel like crap anyways, but then that just makes it feel worse. It's like a little science experiment, in your gut. Alcohol number two, dried fruit and fruit juices. Fresh fruit generally okay in moderation, but dried fruit and fruit juices kind of goes along with the sugar thing I was talking about, though, if you think about it that way. Um, so fresh fruits and berries, all really great part of diet, but like the dried fruit, craisins, any of those like trail mixes, and fruit juice are definitely like a culprit for um, continuing to build yeast in your system. They're so yummy, but like, yeah, dried apricots, like any of that. And I think we think of that stuff as like sort of healthier option. Really have a lot of dried fruit in my diet. Like I love it, but I just don't because it really like And how much do you eat? You end up eating like a lot. And then it's probably like 4 times the calories and sugar of just like fresh. So here and there I might do it, but like generally don't, generally I would say no. Number four, gluten in particular. And I would say an overabundance of grains. I'm not going to say no grains. But again, during this, like, I'm going to call it treatment period, if you are actively battling with yeast or whatever, I would nix most of them because they basically just turn into carbohydrates and sugar. It's just the starch, that's all. The starch and the sugar is what feeds candida. Long term in moderation, there's a place for that for sure. But if you're asking sort of what to do to treat it, that's what I would say. The other one that stinks is beans and legumes. Super starchy. They have some plant protein, really great fiber, but an excess of fiber and starchy things is what's going to mess with the yeast and the candida. Um, Hard to digest sometimes. So like beans is another no-go for me a lot of times. Definitely if I'm not feeling good. Even after I am, I would say I would never, for me personally, again, me, order like a black bean soup or something like that. That's all beans. If I'm making a batch of chili, I will definitely put 1 can of rinsed kidney beans or something in there along with everything else, and it's fine. I might do hummus and veggies, but a smaller portion, then I'm good. So, yeah, that would be in there too. Yeah, less so though than the other two that than the actual beans that I just mentioned. And I'm not talking about green beans or like those. We're talking about like can of beans, you know. Um, Peanut butter less so, I would say. Maybe if you get a tablespoon of peanut butter, probably not a big deal, but like handful of peanuts, that's definitely a legume. So the other thing is not to freak everybody out, but there's high mold contaminants in like peanuts and some of the other nuts. And so then that's candida too. I mean, they're like best friends, in your gut. So yeah.
Coffee too. I'm starting to see more about coffee.
Yes. Yeah.
Roasted.
Right.
But the roasting doesn't take away the mold.
And it's so hard to like, what are we gonna do? Like I try to get like local, but like what do you do? Like go around and test now you can look on some of the coffees and that'll say third party mold tested or whatever. So I like try to get those or I get some stuff from local moments or whatever. That one drives me nuts too because I drink coffee every day and I'm like, oh no, am I just like adding? Like you don't know. It's interesting though because some people have yeast and candida but not bacteria and vice versa. And so as many times that I have tested myself, I have never once had candida or yeast, which is interesting that I have symptoms of bacterial overgrowth but not the yeast. So they can be different. That's when I'll start asking women about like scalp, vaginal yeast, or just like especially in the summer now when it's like warm, if you end up having like just patches and rashes and things like that. Number six, fermented foods. Again, during kind of that like treatment period. Even yogurt, it's so good for you, and dairy's my next one. But until your yeast population is under control, you are definitely feeding it with yogurt. Yeah, it's active. What does it say on the label? Active cultures, right? Well, we don't want those right now. You got enough active cultures going on. So like, uh, generally, a candida diet is low fermentation, low starch, low fiber, low carbohydrate sort of by nature. It's a lot of protein, it's a lot of green vegetables, sort of the non-starchy vegetables, and some fruit in moderation. Like if I were to summarize like what it is, like what's left, that's what I would say. Uh, Dairy is another big one for basically what I just said. That's just kind of feeding the bacteria in there. So when you are eliminating a lot of these foods, sometimes you can feel worse before you feel better. The other thing I would tell you is not everyone needs to go on like a candida diet if you don't, if you're not sure if you have yeast or not. I will tell you, this diet, which seems a little strict, right? But if you did this for like 3 months, I guarantee you probably feel better anyways. If you have weight to lose, you'll probably drop it. Like you could feel amazing and like just clarity and brain fog. So there's like a lot of risk to doing this because we're just going to go to a mostly whole foods, lower carb diet anyways, which is fine for most people. There are die-off symptoms. I had this with my bacterial during antibiotics. Um, you may feel worse before you feel better. I always have to remind myself, like, I'm just killing stuff in there. So, okay, it's going to be good. Headaches, fatigue, brain fog, flu-like symptoms. skin breakouts, rashes, things like that. Sort of more than you had before for like a few weeks while you're sort of, because it's purging, like you're purging all that out of your body. So it's got to go somewhere. And usually it comes through the skin. And so staying hydrated is huge during that because you're trying to detox and support your detox pathways to get rid of that stuff. And if you're not drinking enough water, it's just like sitting in your body and making you feel worse. The other thing is if you are currently actively treating Candida, make sure that you are sleeping enough. Sleep and water. Sleeping. Mm-hmm. Yeah. Yeah. No. That's a whole nother.
Whole other ballgame.
That's like every woman of the age of 50 plus that I work with is that's what's going on. I've had it too. So then we get into hormones and that's a whole nother presentation, but you can be helped with that. I can give you I don't want to like band-aid products for sleep, but there's one that's amazing here. I could tell you after we're done. I never run out. Huh?
I say out to the black.
Oh yeah, black cohosh is yeah, that's one of them that's good. Yeah.
I'm up to my magnesium after your last talk.
Glycinate, 1,000 milligrams.
You put in there.
That's
that
the
you don't have to
easiest, cheapest thing to do. No, 1,000. Yeah.
recording at 600.
Mhm.
It closed that little gap where I was
That you had where you were
between,
up.
like 2 and 3.
Yep. Magnesium glycinate. So you'd have to look at what's in there. So I did another talk on just the different types of magnesium. There's 8 different kinds of magnesium. And you go to the doctor and they're like, take magnesium, but nobody ever tells you what kind. There's all these different kinds. And so if you're taking a whole bunch of magnesium oxide, you're gonna have diarrhea all day. Like that's not help you sleep. Citrate, same thing.
If you're stuck.
Yeah, right. No, and so I use it for that, small amounts. That's how we use it bowel prep for colonoscopy. But like again, I don't like to like give out just like, oh, take magnesium. Somebody comes to me and they say, here's what I'm struggling with. They're gonna get to the root cause of what it is. But also most people are deficient in magnesium. So we might do I like a citrate oxide malate combo for that. You gotta be careful how much. Glycinate won't do that, but that glycinate's great for like that's the best absorbable magnesium. That's good for like restless legs, sleep, relaxation, kind of all those things. So that wasn't even the supplement I was going to suggest, but that's the easiest one to start with because and it's super cheap. I mean, I think mine's $20, lasts me 6 months. I mean, it's so easy to get. Um, so then transitioning off this sort of candida diet without triggering it again, you don't want to just eliminate all this stuff and then go have pizza the next day, right? And so with Whole30, they do that too. So you want to reintroduce some of those foods gradually. Some of those things I would argue really don't have a place in your diet, period. I mean, like some of the sugar alcohols, I think, a ton of starches again. Like it's just, you're just gonna bring it back and you'll probably have some brain fog and you won't feel great anyways. Prioritize just low sugar options in general without always going sugar free, but just lower carb, lower sugar options. Monitor your symptoms and try not to return to some of your old habits because that's the other thing we tend to do is we got rid of it. I'm going to take this supplement or maybe this med and then I eat this way. Okay, I'm good. And then you go back. And then 6 months later, you're like, well, have it again. I wonder why. But you just like, you didn't change anything. It's got to be like a long term change for sure. So herbal treatments for Candida, and I'm going to throw out a couple numbers, but like this is something you'd want to talk with a practitioner about actually treating it. I'm a big fan of like testing it to see if you have it in the first place. Like I said, none of this stuff is probably going to be harmful to anybody, but you just don't want to keep like it's usually like this endless cycle of you keep getting it. Oregano oil is number one. We use that for bacterial overgrowth too. Yep. Um, ADP Naturals is the one that I like. I don't think you guys have that one here. You might have one that's similar. Yeah,
Danny from
you should
Silver
take a
Surfer
lot of
did
this one.
that.
Yeah, I like that one. Um, Garlic is the second. You might smell like a human pizza taking oregano and garlic because if it's coming out of you, like, you just like your skin might smell like pizza in bed. So be prepared for that. Um, Typical dosage, this is Allison, which is good. Typical dosage here is like 1,500 milligrams. And you can spread it out or whatever. Seriously, you'll smell like garlic though, like your hair and everything.
We have the what's the Keolic, is also garlic. I didn't know.
And that has a digestive enzyme in it too, I
She
think.
recommended that used to.
Oh yeah, ginger. Yeah, this is a digestive enzyme plus ginger and garlic, so this is good too.
It used to be named yeast cleanse.
Yes, right, because that's what it's for. Yeah.
I see that right here. Can I see one?
Yeah, you can come up and grab them if you want to, or pass them around. Those are like to keep it simple. Those would be my go-tos right there. Cinnamon and lemongrass are really good for it too. You really have to get like high doses of that stuff, so it's not just like sprinkling cinnamon on your, apples or whatever. But those are good. The other thing that we use for treating yeast is something called caprylic acid. That's an MCT, so a medium chain triglyceride of healthy fats, and that helps break down the cell walls of the candida, like of the yeast, and helping it with the yeast overgrowth. And so usually that's like 1,000 milligrams a day, which sounds like a lot. It's like a handful of capsules, but digestive enzymes was the other thing. We had that there. That can be on its own or in that combo supplement that you had.
Okay, so if you choose to do the keel, do you need to do the garlic?
I would have to like see how much is in there and like look numbers for you, but like
just do one or the other.
Yeah.
This is 5,000 micrograms.
I don't think the yeast cleanse had oregano in it. So that would be maybe the only thing I would add to that one, but
And we have many options for oregano.
yeah, there's a ton of stuff out there too. We just kind of grabbed a few, but
I grabbed the one that's she was out there and I asked her to help me pick which ones and then this one to pick, but we have many options.
um castor oil packs on your belly would be another thing. So castor oil in itself kind of breaks down that.
Well, that's stuff that I haven't tried.
I know.
I'm freaked out that I've never done it like that.
So I've done it for decades probably. And now I have ones that's like that sticks on me so I can sleep with it. Before I was like, you put a towel down, then you lay in bed, then you gotta put you put like a tablespoon of like castor oil. Smells like nothing. Get it in a glass bottle, idea if you can versus plastic. And then I give you a tutorial. FaceTime me next time you want to do it. Literally, just FaceTime me in your bed, and I will like help you. And then you buy. It's like a translucent, almost like a wool cloth, and you want to saturate that with castor oil, and then you put it on top. And then ideally, you should put heat on top of that. I find it pretty relaxing, especially in the winter. However, you don't want to put the heating pad directly in the oil because then it's all messy. So then I usually have to put something. Then I like grab a Target plastic bag, and I was like, here, I was trying not to do plastic, and I just put a plastic bag in here. But there has to be some barrier between all of the oil. Now you're not using it up where it's like dripping all over. I mean, I sometimes have because I was like, oh, I'm just gonna dump this. But it's only like tablespoon. It's specific. You can put it like in your belly button. Uh, and then I would do that for 45 minutes to an hour. But then I like take it all off and go to bed or whatever. But now they make, and you go on Amazon has them. Sometimes you guys don't carry kits here. That'd be castor oil kits.
We have the flannel things next to the castor oil, but they're just big sheet looking things.
Oh, okay.
They don't have like Velcro. I heard there you can get Velcro or something.
So the ones that I had recently gotten are, yeah, I mean, they're sticky. I wouldn't say Velcro. They're sticky though, because I've had them on all day. And so then it's almost, you know what it looks like? It looks like a big Band-Aid. It's like this big, and you just pour the oil on this surface, which like soaks it in. Liver, you can hit your whole whatever area. People use castor oil packs for a lot of stuff, and then I put heat on it, but I don't have to worry about the messy. And I'll put heat on it for 45 minutes, and then I'll just sleep like that. And then I've worn it like underneath my pants like all day. So
and what exactly does it do?
So that's helping detox your system from all this yeast. And if you are cutting all this stuff, you want that stuff like out of your body. We use it for constipation too. But I mean, you just want to, that's like pushing your liver to do its job, basically. And a lot of people have sludgy livers if they have yeast too. And so you're just like getting that stuff out. And it's easy and painless. And
it's not expensive either.
No, not expensive at all. No, it's like a $20 thing, and you can use it over and over again. So
I have a question. Shopping, but there was a choice, I guess, when I bought, and I have a bottle of castor oil in the cupboard, haven't opened it yet. It's in glass. I looked for glass. That one's not organic, and the organic one's in plastic. I'm like,
yeah, I would probably,
It's all organic in glass. But I might have done what you did. I might have plastic because I grabbed organic.
okay, don't throw away whatever you have, just use it. You're not going to die. I probably would choose glass over organic though, for me, just because if that's sitting out and you're just not getting the same, it's been sitting in sun and factory, whatever. I probably choose glass over organic. It's like the same thing we have with like local fruits and vegetables and stuff. Like I would choose a local fruit and vegetable over more organic from farther away, personally. Yeah. Um, and so
I like
yeah. So you can get local and organic, but I'm saying if you can only get one or the other, then that's how I would go. But yeah, the castor oil is so good for you. Don't worry about all the little things. I mean, that's like everything I would tell you. Like if you get in your head about every little thing, you're not gonna, then you don't do anything.
It's gonna sit in your
You should have
cabinet with
yeah, with your 100 supplements and you're gonna have decision fatigue and you're like, this is all too much. I'm not gonna do any of it and I'm gonna go to Burger King and then you have yeast. So
I took this there, but see my like, they buy like that. But yeah, we just
yep. Yep. I work with a lot of people with RA. Yep. Yep. Um, okay, probiotics. I have mixed feelings on these. We don't recommend probiotics during bacterial overgrowth or that. So like everybody's on a probiotic bandwagon. Everybody tries them. Some people feel great, some people don't, right? Well, the reality is we don't know if you need probiotics unless we test your gut and see but like most people aren't doing that. So I think a lot of people, probiotics are the thing I see that people are doing trial and error probably the most. The number one probiotic that's probably helpful for yeast though is Saccharomyces, and you guys have that I think here. Saccharomyces boulardii in particular. Um, and so that's really good. If I am to take a probiotic, that is the only one that I will take also. Um,
we use the yeast nutrition collagen.
yeah, that's a great brand for everything. Yeah.
We
Yeah.
sick as the form.
Yep. Some people will say that they feel better long term with a lactobacillus and bifido in a bacillus, like a soil based bacillus species. Do you have a soil based one here or no?
Yes, I think it's called some ancient nutrition.
Okay. And usually a lot of times that one has to be refrigerated, depending what it is. VSL3 is probably the most popular soil-based probiotic. I was on that years ago to try to help myself and it didn't at all. It was so expensive, like $100, like so expensive. I think I only take one a day, but yeah. So careful with the probiotics. Like if you're gonna choose one, I would do like a Saccharomyces. There's not really any downside to that one, but that one's good, kind of long term. Longitudinal research of clinical trials combining like nystatin or diflucan, like an antifungal, like a prescription, which I don't have too many issues with. Um, if you combine that with the diet that I'm talking about, it stays away quite a bit longer. So 85% of Candida patients who had followed the diet for 3 months plus the med were symptom free significantly longer than others. So after a year, 85% were still gone. And by contrast, the ones that just took the med, only 43% were better. So it's like double.
Yeah. What's the meds? Nice.
Like nystatin is usually what we use for Candida and like yeast. But even if you can get some over the counter or you can get a script. Yeah. Um, and my issue is like if you had that and you treated it with that and it's gone, like okay, and it's like once every 8 years if you get a yeast thing, like okay. But if you like continue to get it, like your body is obviously something's off or like the balance of something is off and you're fighting it. And so kind of the point of the talk today was if this continues to be an issue for you or whatever. Now, not to jump on hormones, but postmenopause connection with yeast is huge too, because low estrogen, especially low vaginal estrogen, is connected with UTIs and yeast. Number one solution for that, for vaginal yeast, is vaginal estrogen. Non-systemic, you can use estriol, estradiol. It's cheap, it's easy. I wish you could put every woman on that by the age of 60, and the incidence of C. diff and honestly sepsis and death for women in nursing homes would be like incredibly better. That doesn't even mean you have to do any other hormones if you don't want, although we have lots of good like bioidentical options these days. Vaginal estrogen, though, yeah, yeast and like UTIs is huge. Because that's all connected with tissue and all that. Yes. Yes, my grandma was too. Probably not, but I guarantee you. Okay, so some of that is, of course, okay, so UTIs, and when people come to, I get a lot of people with UTIs. Then that's like hydration, D-mannose. Seriously, have your grandma do this. Three D-mannose, 3 grams a day if you have an active infection. Otherwise, 1 gram a day, period. And vaginal estrogen. Those 3 things.
Interesting.
So,
I had a raging UTI.
and like if you need antibiotics, please go and get them. But like encefalexin's a good like preventative one if you're gonna do it, like a low dose. But D-mannose, 3 grams a day.
I had not been sick in like.
Oh, I know it's awful.
Years.
Yeah, it's awful.
And
Now brand has one. It's out on the basics floor. They're 500 milligram tablets, so it's 6 a day, so 3 and 3. It's cheap too. It's like $13.
so should you
I
take
keep
off?
it with me. If you are having recurring issues, UTIs, hydration, at least half your body weight in ounces of water. And then the sugar and all that. And UTI is connected with yeast and bacteria too, so it's like the same approach. D-mannose, 3 grams a day if you're having an active infection. Otherwise, 1 gram a day to prevent. And vaginal estrogen. Seriously, vaginal estrogen. And you are never too old for that. You would get that at 90. You should be buried with it.
Like
What? Yep. No, it's an insert, just like vaginal. And you can do a cream or like an ovule. So easy. And it's like moisturizer for your face. Like it just melts.
Because first time
Right.
I tried that, when I picked it up in the pharmacy, they had put a big label on the box that said cancer.
Yeah, that's.
And those have all been removed now.
I know, but I was freaking out.
I know. I know.
Like, why are you giving
Yeah.
this?
You guys look into the like updated research. We don't have any of that anymore. So, and that scared a lot of women over the age of 50 off on all that stuff, right? And so vaginal estriol or estradiol, usually you use it. So it depends on what you're doing it for, but like every night for 14 nights. And after that, it's typically about twice a week.
Twice a week.
Yeah, twice a week.
That's what I said. It's on every.
But if you are having genital urinary symptoms of menopause, bladder issues, you absolutely can use it every night if you want because it's not systemic. It's less than 1%. Yeah. So everybody's a little bit different, but if I could just like hand that out like candy at the nursing home, I swear. So she's having UTIs. Go pick her up some D-mannose from here.
Yeah.
I don't know what she's eating or drinking.
I don't know if she's open to alternative remedies.
But you continue to do antibiotics for that over and over again, and there's like resistance, and then that messes up your gut kind of long term too. Macrobid is a big one they use, but then that's when you get like C. diff, and then you have no like good bacteria left and then that's when we talk C. diff and sepsis, and like you don't. Yep.
It's very scary.
Yeah, it is.
Yeah.
Yeah. How old is she? She's not the
Sometimes a
only
year.
one. Yeah.
She might be right around that.
Mine's 91.
Yeah.
And she is open. She's been, just trying.
Sometimes it's so I'm
Now,
it's
I don't know the rest of her health history, but that would be like a $30 thing. Like, yeah. I'm sure if you told some doctor about vaginal estrogen at 90, they'll be like, why bother? I'd say it's never too late. Like, why?
What if she says, I really want to try this?
She could. I mean, it's her body. Yeah. D-mannose. I don't know how much water she drinks. A lot of times in nursing homes, they're doing coffee and
She's really
juice.
good on water.
Okay, good.
We talked about that.
Yeah. Water, D-mannose, and I would do 3 grams a day for her for life. And that's easy. You also, D-mannose tastes like nothing. You can like open the capsules and put it in something. I'd watch like just kind of sugar already, in her diet, and depending on her weight, then you don't want to have her like lose too much
Started on
weight.
the anti-diabetes diet,
Okay.
which is managed by the places.
Yeah. Okay. But yeah. So, side note, but connected with that, yeast, UTIs, kind of all that stuff. So you want to eat more, and you can look up the glycemic index of fruit. But fruit is fine. You want to eat more of the like lower glycemic index fruits. Your lower carb vegetables, I'm not gonna say never eat a potato, and you'll hear me in here talk about how I think potatoes are awesome. Um, if you're doing a low Candida diet and you cut all that other stuff, I'd say a couple potatoes are probably not gonna, be the worst thing. But we spend so much time trying to avoid potatoes and bananas, and then we eat all this other like Franken food, and it drives me nuts. Like just whatever. Um, and so, but leafy greens, cucumbers, carrots, things like that. More of those things. High quality animal proteins. Um, chicken, turkey. I'm a big fan of beef, probably number one. Um, fish, seafood, pork, any of that, eggs. If you have that and veggies, your non-starchy veggies and a little bit of fruit is like 80% of your diet, you're probably doing well. And you'll hear me say that with almost everything we talk about here because the approach is very similar. But the candida, it's a little bit stricter on kind of the sugar and the carb stuff, the starchy stuff. Nuts and seeds, good. I think, we always say, oh, do the low mold ones. Well, who the heck knows, what that is and whatever. But like, maybe not cashews, pistachios. Those are a little bit higher, more starchy carb. But like, yeah, some nuts and seeds in moderation would be fine. Not what I'm not talking about is the dried fruit, soybean oil coated trail mix from Walmart. That's not what I'm saying. I'm talking about like raw almonds and like things like that. Chia seeds, hazelnuts, flax seeds, that's what I'm talking about. Like add that in there or sprinkle it on top of your. People are like, oh, I have like trail mix. I'm like, that has M&Ms in it. Like, that's like not what I'm talking about. Like super high sugar. Um, beverages, coffee, tea, herbal tea, bone broth, kind of the non-sugar beverages, healthy fats, your extra virgin olive oil, your avocado oil, coconut oil. I got that earlier today. This is my second time here today because I had an appointment on the east side and I was like, I'm gonna grab I always bring my like little parfait or my little breakfast and I totally like spaced it. So I ran in here and they're like, aren't you coming back today? I'm like, yep, I'll be back I was here like 11:30. I'll be back in 6 hours. And now I thought of another grocery item I need anyways, but I got spray coconut oil when I was here because I like that for pancakes and stuff. Any herbs and spices, we talked about maybe loading up on things like oregano, ginger, black pepper, cinnamon, cumin. Yeah. And remember, the oregano, the little sprinkle oregano that you get or the fresh is all good, but it pales in comparison to that. There's like a lot of oregano in there. That's like, medical grade like oregano. Um,
What's that versus like a tincture?
what?
Like I made like a tincture.
Yes, right.
Like,
I've had to be more too, and you're just like,
oh,
yeah.
regular, like what's
Yeah.
the difference?
What's the difference?
Yeah.
Well, that capsule, yeah. I mean, that capsule won't have alcohol in it. So depending on how much you're taking in, that may or may not bother you. Tinctures are very strong. A lot of times, historically, not many people are doing that, but like tinctures are actually stronger than a lot of times the capsules. So yeah, yeah. Like that would be fine too. But you got to do a carry, as you know, carry or like something with it because you can literally burn your esophagus out. So,
It's like painful.
yeah.
You can't like breathe.
I have had a tank. Yeah, I've had tinctures made for me for other things. I'll tell you after. Like somebody tried to kill me. Like it was like something with cayenne in it, and oh, it was for my low blood pressure. I have really, really low blood pressure. And so it was trying to speed like my circulation up. And it was Dr. Carey. She like made this tincture. I was like, oh, whatever. And I put it down. And I was like, I remember texting her, are you trying to kill me? She's like, oh, maybe I put a little too much in there. And I was like, oh my gosh, can't do this. And so I'm like, I'll mix it with water. And no, like I'd have to mix it with the whole, it's just a lot of cayenne in there. Yeah, I was trying to increase my blood pressure and my circulation basically. So
I took cayenne once. I love it. Thinking for my health. And then from the urgent care and like yeah, that same day, my face was just swelling like
yep, pretty flush. Oh yeah, I got warm.
I got swollen.
I got like hot. Well, it sounds like you took 100 times more than me, but I was like, I don't care if this is good for me or not. I'm not taking it. I can't. We're gonna have to balance this with something, or like I try to put in orange juice. I was like, I know tinctures are great, but I'm gonna stick with capsule because I can't. And then God forbid the capsule break open like halfway through your esophagus, because then you could feel that, or you feel a little warming sensation in your like HCl. Yeah, and then that you really gotta be careful. We're trying to preserve our gut lining here, not like wipe it out. Um,
I have one question on acidophilus.
yeah,
So acidophilus balances your system as well.
correct. Unless you have bacterial overgrowth or you have too much of it. You could have too much acidophilus too, just like
Yeah.
lactobacillus and bifido and like all that. So, um, I read like poop tests for a living. And so it's always interesting to see what people have going on in their gut. So that's why it's hard to give like general advice because I like to like test, don't guess. I try to give some like general ideas here, but I think out of all the stuff I talked about, I wouldn't hit the probiotics at the top. Like I would do some of this other stuff first, and especially if you've done them historically, and if you don't feel better, like maybe it's not working.
Well, we used to use it for colds.
Yep, yep, yep,
Yes, yes.
yep.
It works wonders.
It does work great for cold sores, and it's basically like you can take it out of a capsule powder and put it right on your cold sore. Yeah, that I would recommend,
And it's gone.
and it's gone like overnight. You can mix it with a little coconut oil or whatever, like almost like a chapstick, like a paste.
My question is, sorry if I missed it in the beginning. How do you test for yeast? Is it a food test that's along with the bacterial?
So I do it in the course of like a GI map. And those are a little pricey because I'm looking at like other things. Um, so a couple other things that you can do, you have to get that from a practitioner, but like there's a vaginal microbiome test that you can do. And that'll show you kind of what just bacteria, like vaginal bacteria you have going on. And so then that'll test for yeast. So that's a possibility. Um, and not like blood tests aren't great for that, I wouldn't say. So usually it's like usually like a fecal, because that's telling me what's going on in your whole everything, like your gut. So it's gonna be like, yeah, it's gonna be a GI, like a map test. You can ask at a traditional doctor for like a yeast test, but they typically aren't testing for that because it's a little pricey to test. They're just going on your symptoms and giving you diflucan. You know what I mean?
Thing.
And it's just one thing but I will say I don't want to get narrow vision when you were like, oh, I think I have yeast because I have all this other stuff. And what I told you at the beginning is all these symptoms that I listed could also be Helicobacter pylori, methane, Klebsiella, like all these other like bacteria, or I see H. pylori like all the time. So like we just don't want to I don't like to like throw stuff at the wall and see what happens. You know what I mean? And especially if you've been dealing with it for a long time, because like the GI map is like $340. That's like my cost. Like, it tells me a lot. But I like if you have been dealing with the same thing for like a decade, I'm gonna be like, I can't ethically not do this test because then it can tell me what's going on. I don't really you've been guessing for a decade, it's not working. Like, it's good to kind of see that. You gotta ask a doc for that, but usually they'll just give I mean, yeast is pretty like traditional symptoms. Now, some people have sort of outer yeast and they're not dealing with any of the gut stuff. So, and that's possible. You can have some of the outer like yeast stuff without having gut issues. Although the more I talk to people, it's interesting even if I'm not doing a full intake, I'll say, "Oh, do you have any like gut issues?" And then I list like a couple things, and they're like, "No, that's good." I'm like, "Okay, you have a bowel movement every day." Well, no, no, okay. And you're not bloated. I mean, the regular bloating. Okay, regular bloating is no bloating. Just like all those things. Or like, well, yeah, I'm running to the bathroom like after I go out to eat. Like, how often? Every time. That's not normal either. We normalize like so much of that stuff. So I've learned to, in my intake form, I ask like very specific, like numerical questions on things. Same with water. Are you okay? Are you well hydrated? Oh yeah. How many ounces of actual water are you drinking a day? That's my second question. 16. How many of those 16-ounce bottles? One. No. You know, But if I just stopped at the question, are you well hydrated? And they said yes, because I drink that whole bottle of water a day, then I give them, well, you are 180 pounds and we should be shooting for 90 ounces, but let's at least hit 64. And they're like, you have no idea. And then you're like, I'm brain fog and I have a headache and I'm constipated. Yeah, because you drink one 60-ounce bottle of water a day. So, um, yeah, that's one of the things I'm not great at.
Our PhD is in Western medicine and acupuncture.
Oh, yeah.
And
Oh, you're super real knowledgeable. Thanks. You get all that trickle down.
it's
Yeah.
funny when you say that about Chester Cook because she says that she works at a pain clinic.
Yep.
And she just out there, and she did, and all she kept saying, "I wish I could test the poop to
Yes.
see what's going on."
I can do poop tests all day. I love reading labs, but I love the GI map in particular. It's my favorite. The neurotransmitter test is really cool. Like there's some, but I don't ever shove that at people if they don't really like need it. But if you come to me and you say, I've been dealing with this stuff for like so many years and you try this, try that, we're going to test because why? And why would you pay me money to spend 3, 4, 5 months with you to treat it? We don't really know what it is. And why would I throw yeast stuff at you when maybe it's Helicobacter pylori and then that actually does need antibiotics, you know? And but what I often see is it's like multiple things. So sometimes people get really excited. One woman I just did a GI map and then we did I did a SIBO test on her. She's had a whole bunch going on. I'm like, well, typically I don't do both at once because they're both like $300 some a piece. She said, give it to me. I'm ready. I'm so over this.
Yeah.
Give me everything that you want. And I'm like, are you sure? This is like $700. Yeah. She's positive for both H. pylori and SIBO. Never would have known that though had we not done that. And she said, you won't believe how many years and how much money I have spent trying to fix this. And for a few $100, and in about 4 weeks, she was completely better. Because I was just like, bam, here we go. We're going to do this and then we're going to do that. And I worked with her for 6 months, start to finish, on like kind of everything and the diet and all of that stuff. But even doing a real particular diet, if you got a lot of overgrowth, like you got to nuke that at some, level. So, and then that's where some of the Western medicine has a really good place, where we can kind of do both. So that's why my suggestion is sometimes if you do a nice stat, combining that with this low Candida approach, you could be going forever. Or maybe if you're getting like 3 or 4 reoccurrences a year, maybe you go 3, 4 years before you have it again, and then not as big of a deal. Most condiments okay too, but look kind of those lower sugar ones. So like the Primal Kitchen has got a really good like mayo or avocado mayo, like that one's good. Coconut aminos, soy sauce, I kind of like those. Any of your olive oils or like downtown in Bodacious, we got tons of cold olive oils down there too. The other piece that goes along with sort of bacterial overgrowth in general, and so this has been the case for me this last year, is when your stress is really high, that lowers your stomach acid, and that is what breeds bacteria. I can say that sentence to you, but the stress is not something we can take a pill for or even do a diet for. And I'm not saying no stress, but you go through periods of time in your life where you're super stressed, and then that's when you're like everything hurts and everything comes back. And that's why it does. It's because there's really like a biological component to that stress. By the way, I have done acupuncture for some of this stuff too. So like that's a viable, like, and we have quite a few really good providers in town here. So yeah.
But when I was 55, I woke up one morning and I was hard that I needed 2 canes for a while to get to the bathroom. Then one cane during the day, and no cane at night. Next morning, to start going on 2.
Yep.
I had a friend who was a like a naturopathic physician, but had been in car accidents. Who was
Yeah.
Step in the morning, your proteins aren't getting digested well.
Yep.
Take betaine hydrochloride.
Yep. Yep.
I got betaine
Yep.
hydrochloride.
Yep. HCl. Yep.
The next morning, after a couple weeks or so, maybe 2 weeks, I could run
Done.
upstairs.
Yep.
It was miraculous.
So we have millions and millions of people on acid blockers, prescription or not. So that goes from Tums, all the way up to some of the prescription ones. And for a couple weeks, for something, those can be okay. The long-term use of all those acid blockers is messing with your gut. I mean, I have people that I have been like, I've been on this for 20 years. And if you talk to any pharmacist, will tell you that too. 20 years, and all of a sudden, not all of a sudden, but then that takes me sometimes a year to fix because they're having constant, usually diarrhea and like really significant HI. And then now they have all these infections they didn't have before because their stomach acid's low. And that is just a breeding ground for whoever bacteria wants to come party in there. So that's just like a whole thing, but like stomach, like acid blockers, find out the root cause of why you have GERD or reflux or whatever, and don't that those should be like a once in a while thing, or you ate too much pizza or whatever, like or do a couple weeks, do a round on it, but then you gotta fix like the root cause of the number of people that we have on those is just like, yeah. So that's connected with some of this stuff too. Every med that you take, everything that you do, everything you put in your mouth has a side effect and it has a reaction. So you don't want to drive yourself crazy, but you got to think through that. And you might be taking a med and you might be like, oh, it works great. I have high acid, so I'm taking this and then it's lowering my acid and I feel better and I'm good and I can eat whatever I want to do. But over time, you are then lowering your gut acid. So I'll say something really upside down sounding to you. People who have reflux and GERD do not have high acid, they have low acid. It's displaced. Yep, low stomach acid. And so the first treatment I do with that is digestive enzymes and HCl, and then diet change. We do that. And a lot of times people feel awful for about 2 weeks because I have them pull their med. Like I give people the option if they want to slowly like work off it, but I'm giving you this enzyme in the HCl, which is doing the opposite of what the acid blocker is doing. So it's like scary. But what most people do is if they rip the Band-Aid off, they say, I felt awful for 2 weeks, but I came to you feeling awful. What's the difference? And after the diet and the HCl and the digestive enzymes, it's like gone.
My husband gets such a, he sleeps in the light. It's so bad.
Yep.
He walks so.
But if I watched what he ate in a day and if we looked at gut stuff, like I get, it's just that really long-term use of that is it's not great.
Your sphincter at the top of your stomach, under your esophagus, needs acid to stay shut.
Absolutely. You need stomach acid. And as we get older, your stomach acid naturally goes down too. So like even in HCl supplementation as just a regular part of your, regimen, a lot of times people take HCl before they eat a meal. And sometimes it's in digestive enzyme, sometimes not. But in digestive enzyme and HCl. So that is one of the things that I do to prevent my relapse is I take HCl and a digestive enzyme before most meals. And if I forget or I'm at work, whatever, but I just like do the best I can because I know whatever I can do to keep my stomach acid up will prevent the relapse that I have. And when I have a relapse, it's super painful.
I heard it's most important. That it is the most important supplement.
Yeah. And it's very cheap and easy. Now, don't take,
I've taken it for 7.
you don't need to take 20 tablets a day, but let me give you another like fun test. And I have done this like personally. I've done both of these. There's a way to test your stomach acid generally. Have we talked about this before in here? No. It's like a fun little like human body experiment to see like what your stomach acid is. And they're both fairly reliable. I like to do them both and see you got to do them apart like on different days. One is the baking soda test. Half a teaspoon of baking soda in about 2 to 4 ounces of warm water on an empty stomach, fasted 12 hours, no vitamins, no meds. 2 to 4 ounces of water, and I would say half a teaspoon. You could do a teaspoon too. It's going to taste, not good.
No, it doesn't.
Drink it over the course of 15, 20 seconds, like just whatever. Okay. You should absolutely burp that up
So
to drink all that baking soda in the water. Okay. If you don't within a minute, that's not good. When I did it, I didn't burp at all, period. 5 minutes is usually the cutoff where we end the test.
You should burp it all up.
You should not like regurgitate it, but like you should have like burp. You should burp. If you drink all that baking soda, you should burp. If you don't, that's not good. Yes, because it's making bubbles. But if you have very low, great. If you have very low stomach acid,
Like you're making the science.
you're not. Yes, I'm going to give you 2 science experiments. So that's one of them. If nothing happens to you, that is not good.
Yes.
So number 2 is the HCl test. Now, be careful with this, and if you have ulcers or like whatever, not medical advice. So I had done the HCl test too. So same thing, fasted state, empty stomach. Dr. Harry did this with me. I took an HCl tablet every 5 minutes. Okay, so like 1, 2, 3, 4 of those isn't ridiculous. Maybe 1, 2, or 3. And you are supposed to stop when your stomach starts like burning. If you have adequate stomach acid, you shouldn't take be able to take a lot of those because you should already have adequate stomach acid. And if you add HCl to your stomach, it should bother you. It should get warm. Well, I took 15 of those and then just got freaked out and stopped. And I never felt anything. The minute you feel some warmth, this is 25 years ago. The minute you feel some warmth, then whatever, eat a piece of bread or, banana or whatever, and you're fine. It's not like, but that's why I say 1 every 5 minutes. But so that's like a traditional like stomach acid test too.
We buy the big bottle of
Yeah.
especially with protein mix.
Yep. And the HCl is helping you digest protein, which we need. And especially as we get older, a lot of us are protein deficient. But those are 2 ways to see like what's going on with your stomach acid. And that again is connected with bacteria and yeast and all those. So again, we're talking about getting to the root cause of why it's growing in the first place, not just fixing it every time it comes up. That's the difference in sort of like, big picture approach with some of this stuff and nutrition. So, but the 3 other lifestyle things that you can do that have nothing to do with food, which I know I talked a lot about, are the stress piece, because stress lowers your stomach acid, which then breeds bacteria. We know that. Movement, just getting active. You don't need to go run a marathon, but move as much as you can, and that gets your stomach acid going. Number 3 is dental care and brushing and flossing, because that's bacteria, kind of sitting in there too. So, yeah, those would be my big things, I guess. Other questions that you guys had?